Are you going to be a diabetic patient? Then it's very important that we prevent it at the earliest stage so that we don't become drug dependent throughout our life. So it is this area that I'll be focusing today. Probably all of us are aware that India is becoming the capital of diabetes, type 2 diabetes, diabetes mellitus, and everyone is aware of the normal things like the increased blood sugar that happens in the background with symptoms of polyuria, polydipsia, that is increased urine output, feeling of more and more thirst in general, and general weakness. There are many associated symptoms somebody can experience when they are into diabetes or in the prodromal stage of diabetes, like feeling of excessive tiredness, increased rate of sleep, feeling stressed, etc., can be a possibility that you are moving on towards diabetes. Now, my focus definitely at this point of time would be those people who are between somewhere 30 to 45, which is presently the age wherein somebody is going to develop diabetes. Now, 3 points to understand, or you just have to remember. Is there anyone in your family or parents who are diabetic? If both your parents are diabetic, the possibility of the next generation to develop diabetes is almost 80%. If one of them is there, then the possibility is 50%. And are you stressed due to in your life circumstances, in your work, etc.? Do you lead a very sedentary lifestyle? Do you don't have time for yourself and you are continuously running behind, the work schedule, the life, etc., etc.? And finally, the so-called, are you missing the I in behind all these activities? If this is the routine of yours, definitely within 5 to 10 years, there is always a possibility that you will be developing diabetes mellitus, which of course biochemically will be shown by increased blood sugar. But as all of us are aware, it is a stage wherein the body is continuously under the process wherein the blood glucose level is not getting absorbed as it should be, and it will lead to many other complications. Now at this point, what Ayurveda has to offer? Has Ayurveda spoken about prameham or diabetes in any sense? Now the Ayurveda, the pride of the treasure of India, the greatest document ever documented with respect to many clinical entities comes in the Samhitas like Charaka Samhita, Susruta Samhita, Ashtanga Hridayam, Ashtanga Sangraham, which has perfect documentation of a spectrum of disease coming under the so-called prameham. And what is prameham in Ayurvedam is, it is represented by two basic symptoms, prabhuta mutrata and avila mutrata. It indicates the urine output is highly increased as well as there is turbidity in the urine. It will be associated like symptoms like general weakness, burning sensation, karapada taladaham, that means burning sensation in the palm and the foot area, and there is the excessive occasionally salivation, general weakness, alasyam, the feeling of laziness, unable to do the activities on the daily routine. And there are so many lakshanas that has been told as purva rupam, that means prodromal symptoms of prameha, which includes the earlier symptoms that I have mentioned. And it has been classified basically broadly into sahaja prameha and apatya nimittaja prameha. Sahaja prameha, which is basically because of the bija dushti, somewhere near to the type 1 diabetes, and apatya nimittaja prameha, which is basically because of the wrong lifestyle and the food habit that basically a person follows. So the type 2 diabetes comes under the spectrum of apatya nimittaja prameha. Now somebody who is going to develop prameha with these lakshanas in the background, I think Ayurveda has the greatest role in preventing further progress. Somebody who is in 30 to 35 age group, if he undergo a Panchakarma therapy at the earlier stage, definitely if he is able to follow some of the Patya's food and diet regimen, he will be able to at least postpone onset of diabetes for at least 5 to 10 years. There is no doubt about it, and it's our experience. Now, what is the role of Panchakarma at that particular point? When we basically assess the patient individually, and we have this notion that he will be developing or he will be into the pathogenesis of this disease, he is in the pre-diabetic stage, we'll be making the person undergo different Kriya Krama or Panchakarma, the penta bio-purificatory therapy that is responsible for making the body fit for the upcoming disease basically. So the different Panchakarmas like Vamana, that is therapeutic emesis, Virechana, that is purgation, Vasti, that is different therapeutic medicated enema. These are all the processes that detoxify the body and prepare the body so that it is more active and the body mechanism or metabolism becomes more rejuvenated, so that the normal blood sugar, everything is in control, rather becomes control. So how do we do Panchakarma? After very specific assessment of the patient and his analysis with respect to many factors, after clinical examination, wherein we will be assessing the patient in our examinatory mode like dosha assessment, etc., which is not much familiar to our common public. After that, we will be preparing the person for the intended Panchakarma according to his Prakriti, his dosha dushti, the lakshanas or the clinical symptoms he is developing. And once the person undergoes such a process and detoxification of the body happens, we will be prescribing some specific diet regimen and vihara, some specific exercise regimen, which a person can definitely follow, and to a great extent we can prevent the onset of diabetes in near future. I think as the community in India, it's our responsibility to prevent the occurrence of diabetes rather than making the whole community dependent on some drugs throughout our life. At this particular point, I totally believe that Panchakarma and Ayurveda has a lot to offer, and I'm sure we'll be able to utilize this. And we are there for you to help in that aspect. Thank you.